Have you ever worried about cancer? Most people have. We donate to cancer research. We run marathons for it. We fear it. We talk about it. But what if I told you that another disease is killing more people every single year than all cancers combined? A disease that doesn't always cause pain at first. A disease that often gives no clear warning. A disease that millions of people are living with right now, without knowing it. Heart disease. If you are over 30, if you sit for long hours, if you experience stress regularly, if you eat processed food more often than you'd like to admit, you need to hear this. Because cardiovascular disease is currently the #1 cause of death globally. And in the United States and Europe, it kills more people than cancer. And the most frightening part? It often progresses silently for decades. Cardiovascular disease is an umbrella term. It includes coronary artery disease, heart attacks, strokes, heart failure, and high blood pressure-related damage. At its core, it's a problem of the blood vessels and the heart muscle itself. Your heart beats about 100,000 times per day. It pushes oxygen-rich blood through a vast network of arteries. These arteries are meant to be flexible, smooth, and open, like clean pipes. But over time, damage begins. Tiny injuries form in the lining of the arteries. Cholesterol particles, especially LDL cholesterol, begin to slip into these injured areas. The immune system reacts. Inflammation begins. Plaque slowly builds up, year after year, decade after decade. According to major global health reports, cardiovascular disease accounts for nearly 1 in 3 deaths worldwide. In the U.S. alone, someone dies from heart disease roughly every 30 to 40 seconds. In Europe, it remains the leading cause of mortality despite medical advances. What makes this especially dangerous is that many people feel completely fine until they don't. Let's break down how the damage actually happens. When you consistently consume excess saturated fats, refined sugars, and ultra-processed foods, when you don't move your body enough, when stress hormones like cortisol stay elevated, your blood vessels begin to stiffen. High blood pressure adds mechanical stress to artery walls. High blood sugar damages the delicate inner lining. Smoking introduces toxins that accelerate inflammation. Even chronic sleep deprivation disrupts metabolic balance. Here's the chain reaction. Damage to the artery wall occurs. LDL cholesterol enters the damaged area. The immune system responds with inflammation. Plaque forms and thickens. The artery narrows. Blood flow becomes restricted. Over time, that plaque can rupture. When it ruptures, a clot forms rapidly. If that clot blocks a coronary artery, part of your heart muscle is starved of oxygen. That's a heart attack. If it blocks an artery in the brain, that's a stroke. And these events often happen suddenly, even in people who felt okay the day before. Now, let's talk about early warning signs. In the early stages, cardiovascular disease can be subtle. You might notice shortness of breath when climbing stairs. You might feel unusual fatigue. You may experience mild chest discomfort that comes and goes. Some people feel jaw pain, neck tightness, or pressure in the upper back. Others dismiss heart palpitations as anxiety. Women, in particular, often experience less classic symptoms. Nausea, dizziness, unexplained exhaustion. These can all be early cardiac signals. But many people ignore these signs. They attribute it to aging, to stress, to being out of shape. And that delay can be deadly. Now let's talk about root causes. First, lifestyle. A sedentary lifestyle is one of the strongest risk factors for heart disease. Sitting for prolonged periods reduces circulation efficiency, impairs glucose metabolism, and contributes to weight gain. Diet plays a central role. Diets high in trans fats, excessive sodium, added sugars, and processed meats are strongly associated with cardiovascular risk. On the other hand, diets rich in vegetables, fruits, legumes, Whole grains, nuts, olive oil, and fatty fish have been associated with lower risk. Second, genetics. If you have a family history of early heart attacks or strokes, your risk may be higher. Some individuals inherit conditions such as familial hypercholesterolemia, which causes extremely high LDL levels from a young age. However, and this is important, genetics loads the gun, but lifestyle often pulls the trigger. Third, environment and stress. Chronic psychological stress increases blood pressure and inflammation. Air pollution has been linked to higher rates of cardiovascular events. Poor sleep alters hormone regulation, increases insulin resistance, and raises blood pressure. Modern life creates the perfect storm. Now, let's address medication, because this is important, especially for audiences in the US and Europe. There are several major categories of cardiovascular drugs. Statins are among the most commonly prescribed. They work by reducing cholesterol production in the liver and increasing the liver's ability to remove LDL cholesterol from the blood. Large clinical trials have shown that statins reduce the risk of heart attacks and strokes in high-risk individuals. Blood pressure medications, such as ACE inhibitors, ARBs, beta blockers, calcium channel blockers, and diuretics, help lower blood pressure and reduce strain on the heart. Antiplatelet drugs, like aspirin in certain patients, reduce the likelihood of clot formation. For people with established heart disease, these medications can significantly reduce risk. They save lives. But here's the truth. These medications manage risk. They do not erase decades of arterial damage overnight, and they do not replace lifestyle change. Some medications may have side effects. Statins, for example, can cause muscle pain in some individuals. Blood pressure medications can cause dizziness or fatigue. That's why decisions about medication should always be made in consultation with a healthcare professional. And it's critical. Never stop prescribed heart medication without speaking to your doctor. Suddenly stopping certain heart medications can be dangerous. Now here's the good news. Your cardiovascular system has remarkable capacity for improvement. Research consistently shows that lifestyle changes can significantly reduce risk, and in some cases, slow or partially reverse early arterial disease. Nutrition is foundational. A heart-healthy dietary pattern emphasizes vegetables and fruits in abundance, whole grains instead of refined grains, healthy fats from olive oil, nuts, seeds, and fatty fish, lean protein sources, limited processed meats, reduced added sugars, moderate sodium intake. The Mediterranean-style diet, for example, has been associated in multiple studies with lower rates of cardiovascular events. Physical activity is powerful medicine. The American Heart Association and European guidelines generally recommend at least 150 minutes per week of moderate-intensity aerobic activity, such as brisk walking, plus muscle-strengthening activities. Exercise improves blood vessel flexibility. It increases HDL, the good cholesterol. It lowers blood pressure. It improves insulin sensitivity. It reduces inflammation. Sleep matters more than most people realize. 7 to 9 hours of quality sleep per night is associated with better cardiovascular outcomes. Chronic sleep deprivation increases stress hormones and blood pressure. Stress management is not optional. Mindfulness, meditation, time in nature, social connection, and even simple breathing exercises can reduce sympathetic nervous system overdrive, and regular checkups are essential. Know your numbers: blood pressure, LDL cholesterol, HDL cholesterol, triglycerides, fasting blood glucose or HbA1c. Many people with high blood pressure feel completely normal. That's why it's called the silent killer. Now, who needs to be especially cautious? If you are over 45 for men, or over 55 for women, if you smoke or have smoked, if you have diabetes, if you are overweight or obese, if you have a strong family history of early heart disease, if you have high blood pressure or high cholesterol, If you live under chronic high stress, if you fall into one or more of these categories, proactive screening is critical. But here's something important for everyone. Heart disease is not just a disease of the elderly. We are seeing increasing rates of metabolic syndrome and early cardiovascular risk in younger adults, largely driven by sedentary behavior, processed diets, and chronic stress. The tragedy is that much of this is preventable. Imagine your arteries as highways. When traffic flows smoothly, everything functions well. But if debris accumulates slowly over decades, lanes narrow. Traffic jams form. Eventually, a complete blockage can occur. You don't wait for a bridge to collapse before inspecting it. Why wait for a heart attack before taking your heart seriously? Cancer is terrifying, and rightfully so. But heart disease deserves at least as much attention. The difference is that cardiovascular disease often gives you decades of opportunity to intervene. Small changes compound, replacing sugary drinks with water, walking 30 minutes per day, cooking more meals at home, managing stress proactively, getting regular lab work, taking prescribed medications consistently when needed. These actions may seem simple, but over 10, 20, 30 years, they can mean the difference between vibrant aging and a sudden cardiac event. The message is not fear. The message is awareness and empowerment. Research shows that up to 80% of premature heart disease and stroke may be preventable through lifestyle modification and risk factor control. That statistic should not scare you. It should motivate you, because it means you have influence. You have agency. You have time. If you start now. If you found this information valuable, consider subscribing to this channel. We break down complex health topics into clear, science-based insights designed to help you take control of your long-term well-being. Share this video with someone you care about, especially someone who thinks heart disease won't happen to them. Your heart has been working for you every second of your life. The question is, will you start working for it? Talk to your doctor. Get your numbers checked. Make one meaningful change this week. Because while cancer deserves our fear, heart disease demands our daily attention. And the earlier you act, the more powerful your prevention becomes. Take care of your heart. It's the only one you have. And I'll see you in the next video.